clinical test for sensory interaction in balance, presented by Dina, Skylar, and Kate.
The purpose of this outcome measure is to examine body sway under 6 different sensory conditions. It is ordered, so you have to start at condition 1 and progress to condition 6. This establishes how well a patient can use their fallback sensory modalities when they are deprived of one or the other. However, the vestibular modality is not distorted or taken away.
This shows what part of sensation is being taken away with each of the trials.
This is the criteria and grading scale. If any of these 4 things for the criteria happen, then the time stops.
Okay, so this is trial 1. So for trial 1, we're going to have the patient standing up with their arms crossed, hands on shoulders, feet together with ankle bones touching, and they're going to be keeping their eyes open for this. And they will stand here for 30 seconds or until one of those criteria to end the test was met. So for the second trial, it is the same positioning as the first trial. So arms crossed, hands on shoulders, feet together, ankle bones touching, but the patient's eyes are closed. You'll have them stand here for 30 seconds or until one of the criteria to stop the test is met. For our third condition, we have the same positioning, so arms crossed, hands on shoulders, feet together, ankle bones touching, and the dome on the face. Eyes will be opened underneath the dome. So for condition 4, positioning still stays the same, but we have the foam pad that the patient is standing on. So we have arms crossed, hands on shoulders, feet together, ankle bones touching, patient's eyes are open. All right, so for condition 5, we have arms crossed, hands on shoulders, feet together, ankle bones touching, standing on the foam pad, and the eyes are closed. All right, and then for the final condition, we have the patient's arms crossed, hands on shoulders, feet together, ankle bones touching, and then we have the dome. Their eyes are also opened underneath the dome, and you would hold here for 30 seconds. So if the patient has increased sway or loss of balance, this can determine which system they are dependent on, and these are all listed on this slide.
There is a modified version of the CTSIB that only uses 4 trials and does not include the dome, as it is hard to keep the dome sanitized. For the non-modified version, there are different protocols that include head rotation to distort the vestibular inputs.